What's up guys, I'm Taylor with Anywhere Clinic, and today I'm here to walk you through treatment preparation where we'll go over the safety procedure and protocol. Now this is the beginning of your healing journey. It's a time to put on a pair of headphones and an eye mask and really dive into your own world and just sit with your own thoughts. Can you think of the last time that you did that? Probably never. So the invitation is to increase self-awareness, to build the best relationship you'll ever have, which is the one with yourself, of course, and to step into one of your greatest superpowers, and that is the ability to heal yourself. Now, first things first, be sure to do your research on ketamine and what it does to the brain. You want to understand the science so that you can better trust what's going into your body. Next, I highly recommend having a program to follow along with, whether it's a built-in curriculum like the one on anywhereclinic.com/myketamine, or it's some other therapy like traditional talk therapy, EMDR, or TMS. Now, integration is also crucial, so be sure to schedule in an appointment around your third or fourth full dose session. This is going to really help you set the waypoint as to where you want to go and solidify your results. Now, music. Once you've gotten familiar with ketamine and what it's done to the brain, you want to download Spotify and find some music playlists to listen to. In the member portal, you'll be able to find plenty. We have a bunch of great playlists to explore. Now remember, music is very much so the architect of your journey, so be sure to listen to something calm, inspiring, or peaceful. You'll also want to sign up for premium so you don't get a random Geico or Crest commercial mid-session. It's not fun, I'm speaking from experience. And don't worry though, Spotify will actually give you a free trial for 90 days, so you won't have to worry about paying anything up front. You can use it for the duration of your sessions, and then just cancel it afterwards. And lastly, be sure to turn on crossfade so that your transitions between songs are seamless. Sometimes a pause or break between songs can throw you out of the zone, so crossfade can help you keep in the flow. You can find that under the playback tab in settings. Now as far as the safety protocol, on the day of your session, be sure to fast at least 3 to 4 hours before your session and avoid liquids about an hour or two before as well. This is going to increase the absorption rate, decrease the chances of nausea, and then of course keep you from having to use the restroom mid-session. Now keep in mind the biggest concern with at-home ketamine is falling, so staying put until your session is over is very important. Now a few things that you'll want to note is that alcohol, marijuana, stimulants, and benzodiazepines can counteract the effects of ketamine significantly, so just be mindful as far as use day of. I, however, hate taking coffee from people, so if you're going to have it, do it in the morning, and you're having a session night, you'll be just fine. Now as far as materials go, here's the checklist. Good pair of headphones, noise canceling are obviously the best, an eye mask, journal, pen, and a cup if you are spitting. Now note, if you ingest, it will increase the chances of nausea significantly. It'll increase the duration of the session and intensify the psychedelic experience, so be sure to speak with your provider before doing so. Now you'll also want a peer monitor, and that's just someone that's going to be in the home with you during the time of your session. It could be a friend, family member, or someone that you trust. Now, they don't have to be in the room with you, but just in the vicinity in case you need help, support, or need to get to the restroom. By the way, there's no shame in crawling. I am speaking from experience. Now you may also have the option to take Zofran or nausea medication, and if you do, be sure to take that about 30 minutes before your session. Now when it comes to dosing and frequency, your provider may have already mentioned to start low and go slow. The first 2 sessions are usually an acclimation dose to just get your feet wet. We don't want to blast you off immediately into the ketaverse, and that's what we're saying. So most likely you'll want to start around 100 milligrams or half a troche and increase by half a troche until you get to 2 full troches or lozenges, and you can literally just cut those right in half. Now note, if you find yourself getting really good results before then, there's no need to push to a full dose. Everyone is different, so don't be discouraged if you don't have a psychedelic experience right away. It's not directly related to the efficacy of the medicine. The real results usually show days following, so you want to notice things like responses to triggers and self-talk. Those are 2 of the key indicators that ketamine is doing its job. Also note that it can take anywhere from 6 to 8 sessions, sometimes longer, to get a full neurobiological level reset. So just be patient and remain consistent, at least 1 to 2 times a week. Now remember, if you're doing a session twice a week, you'll want to have at least 3 to 4 days in between so you're not building a tolerance too quickly. That way you're giving the medicine a chance to do its job. Last but not least, we've reached the fun part, absorption. Now, set and setting is very important. Your mindset and the space that you create so that you determine the energy of your journey. So if you had a tough day, it's okay to postpone your session until later because that can have an influence on how your journey goes. And when it comes to setting, have comfortable pillows, furry blankets, whatever that you can use to create a safe space to surrender and let go. I don't recommend lighting candles. I don't want to send you or give you a panic attack, speaking from experience again. Now, when you're ready, you can take the troches, you'll put them in your mouth while sitting upright, and you're going to set a timer for no longer than 15 to 20 minutes. And then you'll start to chew the troches with your front teeth until they liquefy. You'll then swish that around for the remainder of the time. And I don't mean to swish around like Listerine, just gently. And be sure not to swallow. You're gonna look like a chipmunk by the end of this. And look, I get it, it's not the greatest taste, but I tell everyone we don't take medicine because it tastes good. Plus, your bitter receptors are gonna numb after 2 to 3 minutes, so you'll be fine. To distract yourself though, be sure to journal, set your intentions. I personally like to watch nature videos on YouTube. And once your timer is up, you'll either spit or swallow. You're gonna put your headphones in, slide your eye mask on, start your playlist, lay back flat, and take your journey. And remember to breathe, trust the experience, let go, surrender, observe, and lastly, be open to whatever comes up. I wish for you all a beautiful journey ahead, and thank you for being a part of the Anywhere Clinic family. Please reach out if you have any questions or need any